So the focus of this part of our conversation is the development and deployment of tests, treatments, and vaccines. So maybe let's start with the testing part of this. How would you assess where we are, and can it be fixed?
If you think back to the early days of this pandemic, when we put in place a synchronized national shutdown, if we had had the tools to know actually where this virus was spreading, and we didn't have them, people who are critical of the lockdowns now and, retrospectively judge the decisions we made in March, the reality was back in March, we had no idea where this was spreading because we didn't have a diagnostic test, which I think is going to be looked back upon as one of the really key failures here.
It really goes to the heart of the diagnostic industry. Diagnostics fuels personalized medicine, diagnostics fuels cancer care. It fuels so many of our medical decisions. And in fact, it should be fueling the work that we're doing around managing COVID in this country.
We have the worst healthcare crisis in the history of forever for this country, right? And in March and February, the advice was stay at home and don't go to a physician office or health system to get your test done. But yet we got to get this test done somehow, and everyone needs it. So what's the best way to deal with that? The best way to deal with that is people need testing in their home. And not just for this, but for influenza. This is something that has been needed in our healthcare system forever, is an embracing of bringing consumer healthcare to that person's home.
The other thing that's interesting is if you think about it, the technology existed previously, and we had offered telemedicine visits, and our uptake was in the single-digit percentages. So we didn't see as much as you might think, despite all of the talk publicly about telemedicine. And so again, it took a crisis to bring that to the forefront.
How would you characterize the sort of global collaboration and the status of data generation and sharing?
Well, I think you have, as I said earlier, you have these political drivers, and I think that will be a reality for all of us going forward, especially on your side of the ocean then for the next months. But I really believe again that the scientists and wherever they are, I've seen it personally in the field of HIV. I see it now happening again in the field of COVID-19, how scientists come together. And I see also, for example, in the development of vaccines, I know that all the vaccine developers, they have regular contacts with each other. They have a regular a platform where they share data on information.
COVID-19, I think up to a certain extent could be a kind of a very special moment for the development of personalized medicine, because we have the opportunity of having a much more, let's say, aggressive approach to our understanding of the biology going beyond the genome.